You're listening to Body by Poly. I'm Dr. Alain Polynice, here to share what I've learned over 25 years in breast and body surgery. Real talk, honest recovery, and the truth behind lasting results. Let's talk about Ozempic, the Ozempic body and the skin laxity epidemic. You know, GLP-1 medications are here to stay. They're really amazing in what they can do for patients and causing dramatic weight loss. And I can't tell you how many patients I see who come to my office and they say, I've lost 80 pounds and I don't like what I see in the mirror. So there are a lot of considerations with that. Obviously, when patients lose a significant amount of weight in a relatively short period of time, you know, the skin barely has time to retract. So we have patients coming in with significant amounts of loose skin in the neck, the arms, the breasts, the abdomen, everywhere really, all along the buttocks and thighs. So we're really having to tailor these combined approaches to address all of these skin laxity areas. So for example, you know, tummy tucks or lower body lifts with thigh lifts, arm lifts, breast lifts. These are all combination procedures that we're really offering to patients who have lost these massive amounts of weight rapidly. But one of the considerations with these GLP-1 medications is that they do provide significant weight loss rapidly, but they also come with muscle loss. So that's something that is very important to keep in mind when planning these cosmetic procedures. So there are a lot of considerations when patients come in and they're on Ozempic or any GLP-1 medication. It's important for them to be at a stable weight for at least 3 to 6 months before considering surgery. So you have to taper the dosage of the medication so you're on the maintenance dose at least for that period of time and you're stable at your weight. You don't want to be actively losing weight while considering any cosmetic surgery. And one other thing, you know, these medications delay gastric emptying. So one very important thing is to be off the medication for, in my practice, at least 2 to 3 weeks before surgery. Because if you're still on Ozempic and you have surgery, that can increase the risk of reflux and aspiration with pneumonia. So a very real possible complication. So yes, Ozempic's here to stay. GLP-1s are here to stay. I see a lot of these patients in my practice. And, you know, we're talking about combination procedures, sometimes staged procedures to really address all the areas of skin laxity after the weight loss. So, you know, patients are really doing great with these medications, but there are a lot of important considerations to keep in mind when considering plastic surgery after weight loss. Thanks for tuning in to Body by Poly. If you found this helpful, hit subscribe and follow along on YouTube, Apple Podcasts, or Spotify. See you next time.